I'm talking about the opioid epidemic, because we do have an opioid epidemic. And actually, we have a drug problem. We don't just have an opioid epidemic. We have a marijuana epidemic. We have a methamphetamine epidemic. We have an opioid epidemic. And here's the graph from the Colorado Department of Public Health and Environment. Right? CDPHE data. This is state data from our health department. And again, if you look at 2000, 2001, we had medical. And you have to take this in the context. In Colorado, 92% of medical marijuana cards are for pain. And again, kind of the reason I'm talking here is, because we need to know more about the effects and the use in pain. So 90% are for pain in Colorado, 4% are for cancer. But we had medical marijuana in 2001, 2009, we had de facto legalization, 2014, we implemented recreational use, personal use, but our overdose deaths continue to rise. And if somebody can point out to me on this graph where marijuana has had a good impact on our opioid epidemic, please point it out to me. I can't see it. And not only are we having people dying from opioids, we have people dying from methamphetamine. Look at the graph on the meth overdose deaths. Look at heroin. Cocaine's making a comeback, and between 17 and 18, fentanyl went up 26%. I can't see on this graph where marijuana for use in pain has had an impact on our opioid epidemic. I don't see it. If you can see it, tell me, show me, demonstrate to me where it is. I can't find it. And actually, people don't purposely overdose. We had a young girl from Colorado a week ago who comes from a good family, no psych history, no drug abuse history. She was at a party. One of her friends bought a Xanax off the street. It wasn't Xanax, it was fentanyl. She didn't purposely go out to kill herself from an opioid overdose. If you look at El Paso County kind of center in the state, that's where I live. Let me go back one slide. Vermont's population is about 623,000 and 9,600 square miles. El Paso County, where I live, you can fit the entire population of Vermont in El Paso County, where I live, and compare that to the rest of the state. We have 2,100 square miles in El Paso County, 700,000 people. Vermont is bigger, less dense, and less people. So you can fit it inside the county. So this is the overdose death chart over time. And the darker the color, the more people dying from opioid overdoses. So this is back in 2002, right after medical marijuana, 2005, 2008, 2011, and 2014. So if somebody can tell me where it's had an impact, I'd like to know. And to your point, let's look at California data right here. So we have an opioid epidemic. I'm not going to deny that. And being part of the Colorado Pain Society, we actually had a seat at the table to help pass legislation on lower prescribing, no co-prescribing with benzodiazepines. As a member of Colorado Pain Society, people are like, oh, you're pushing pills. I'm like, no, that's not what we do. I see these people come to me on huge doses of opioids. I'm like, you have a problem. You have an opioid use disorder. Maybe we should use buprenorphine or Suboxone instead of methadone. Might be safer, better for medication-assisted treatment. And if you look at California data, I just pulled this off. I downloaded this February 16th, so last week. And if you look on the right-hand side, the MMEs or morphine equivalents over time in the past 12 months has gone down. The number of opioid prescriptions have gone down. The number of prescriptions with more than 90 morphine equivalents has gone down. On the bottom right, you can see the number of prescriptions for buprenorphine, which is the treatment for opioid use disorder, has gone up. So California is pushing back on the opioid epidemic in the right way. The co-prescribing of benzos and opioids is going down. So prescription rates are going down, buprenorphine is going up, but over here, their overdose deaths continue to rise. They continue to go up. Same thing in Illinois. You look at the total prescriptions, average day supply going down. You look at high-risk patient populations, with high benzo-opioid combinations or those with more than 90 morphine equivalents. Those are all going down, but people are continuing to die more. So what's happening here? We do have an opioid epidemic. Circling back to Vermont, this is just kind of historical because whenever I'm in a community, I like to learn or try to educate myself about what's happened there. The ninth state to legalize for medical cannabis, and then you had the registered patients, dispensaries, possession. But opioid overdose deaths in Vermont, nearly tripled between 2010 and 2017. So here's kind of the graphic on that. And I put El Paso County in there because population-wise, we might be a little bit bigger than the state of Vermont. So we had a little bit more. So I mean, it's almost I think it's a good comparison, El Paso County to Vermont, just based on population. But your opioid overdose deaths are going up as well. And I do know from the NIDA website in Vermont, prescription rates are going down as well here in Vermont, but your overdose deaths are continuing to go up. And again, I think a lot of these are accidental. Fentanyl is a big problem. You know, we have the Chinese fentanyl is ending up in heroin. It's being cut in Xanax tablets. And this young girl who was 21 years old thought she took a Xanax and just never woke up. So here's the Vermont data, and there's kind of the prescription rates that you alluded to before. Yeah, we're prescribing less, but people are dying more. And I think it's not because they're purposely killing themselves and overdosing. A lot of this is accidental because of these other factors that are there. You know, the Bach-Huber study in 2014 that showed, oh, look, medical marijuana we're seeing lower opioid overdoses. That was in 2014. A lot of data was kind of preliminary at that time, but Keith Humphreys at Stanford University in California used the same methodology in 2019 or 18 and showed that medical marijuana states have a 23% higher incidence of opioid overdose death than non-medical marijuana states. And here's part of the lawsuit. You know, everybody's suing Big Pharma. You know, they did a terrible thing to our country and to people that are dying from opioids and drug addiction. So this is in my local paper, and I left the term opioid out for a reason. So hundreds of U.S. cities and counties are parties to the suit, which claim that big name manufacturers and distributors use deceptive advertising and marketing to overstate the benefits of blank, and the word was opioids, and understates the risk of addiction. As a result, the suit says governments have had to pay more for social services, law enforcement, and other government functions. You can put tobacco in there, right? Tobacco would use the same thing. You can put marijuana in there. I mean, they're using the same playbook as big tobacco. You know, it's an addiction for profit industry. So currently, and it's very important to understand, because I ruffle a few feathers when I make these statements, but there currently is zero evidence in the medical literature that dispensary cannabis, important term, helps for chronic non-cancer pain. And I'm not a nihilist. I'm not going to say there aren't components of the plant that could help with pain, but dispensary cannabis has not been proven in the literature to help with chronic non-cancer pain. The data shows Sativex, which is a natural cannabinoid not available in the US. It's a 1:1 THC-CBD ratio used for MS-related spasticity in Europe and Canada, not available here. The science helps more with that in cancer pain, as well as with synthetic THC, which we've had for decades. Marinol or dronabinol, which is a synthetic THC, has been around since 1986. Nobody's asking me for that for their pain, even though it's a synthetic THC, right? The problem, don't get me started on big pharma and big insurance. I'm not a fan. I don't like big pharma at all because I actually had a patient who had a chronic sternal pain because he was a heart transplant recipient, and he had his chest opened and the heart taken out and a new one in, and they had a plate in his chest and they got infected, so they had to crack his chest again and take it out, and they had that several times. He was being treated in Southern California at UCLA, moved to Colorado, and he had chronic sternal pain. And he came to me on moderate dose opioid, and he and I had a very open discussion about his opioid use. I said, we don't want to go up. He goes, yeah, but I'm really struggling here. And then the story goes, well, my friend's mom had a heart transplant, so my friend started a dispensary, and now he's giving me his product, his CBD, out the back door. I go, you don't do that, because it's not legal in Colorado Springs. I said, go to Manitou or go to Pueblo, go to Denver. If you want to buy legal stuff, don't do it, through a friend of a friend. So I had a discussion with his transplant pharmacist, and this is what people just don't know. CBD, I'm gonna get to CBD in a little bit. CBD is not gonna get you high. It's not psychoactive, right? But it's not benign, right? There are side effects to it. Have you guys heard of Epidiolex? Anyone? It's the FDA-approved natural cannabinoid, CBD, that's available for a very narrow spectrum of pediatric seizure, Lennox-Gastaut, and Dravet syndrome. I called this transplant pharmacist, and go to their website and look at warnings and precautions. The first thing you're going to see is liver toxicity. And if you are going to recommend for a kid to use Epidiolex, which is natural CBD, purified, not contaminated, they recommend getting baseline liver tests on these kids and follow them, the liver functions, right? They don't tell you that with Tylenol, which has a liver effect, right? So I cautioned my friend, because I talked to the transplant pharmacist. I go, he's using CBD. He goes, bad deal. I go, why? He said, because in Denver, the organ transplant team are finding that patients with organs, organ donors, or recipients that are using CBD are having a hard time maintaining their organs for risk of rejection because, here's the science part, CBD competes with the cytochrome 3A4 in the liver with the anti-rejection medications. So they're at risk for organ rejection. I didn't know that until I talked to the pharmacist. But go to Epidiolex website. Liver toxicity is number one in terms of warnings and precautions. There's no evidence of substituting opioids with marijuana. I like the idea. Don't get me wrong. I would love to get my patients off their opiates and maybe use something that is not going to be a risk for overdose death, because people don't overdose really on marijuana. They'll probably fall asleep first before they overdose, because there is a lethal dose, but it's huge, right? But the evidence isn't there, the scientific evidence. I've had anecdotes, and people here may have anecdotes, which is great. Every now and then I'll have a patient say, you know what, I'm not using morphine anymore, I'm not using oxycodone anymore. Great, I don't have to worry about writing a prescription. What are you using? Well, I'm using marijuana. Fine, I don't care. I don't have to write you a narcotic anymore. That's kind of the exception, not the rule. I wish there were more like that, to be honest with you, but it just doesn't happen. And I've had people come in, I've been in public venues, I'm off my opioids and marijuana saved my life, that's great. From a scientific perspective, that's called an anecdote. It's not science. It's not evidence. I have a bag of anecdotes. I can't tell you how many patients have come to me, the reason I'm here, telling me marijuana doesn't help for their pain. Because when they come in with 8 out of 10 pain and they're on 300 of morphine a day and they're smoking 3 grams of weed a day and their pain is still 8, I go, pick one. What one works the best for you? And if marijuana does the trick for you, fine, let's taper you off your opioids. I'm fine with that. 99% of my patients that I have that conversation with say, I'd rather stick with the morphine, I won't use marijuana anymore. And I go, why won't you use marijuana anymore? Well, it doesn't really help for why I'm here. I go, what does it do? It makes me sleepy, not care. That's kind of the typical story I hear. Large study, Olson, from a few years ago, showed they followed 43,000 people initially with a follow-up of 34,000, so a huge number of people that were more likely to, marijuana users, based on an N of 34,000, were more likely to develop opioid use disorder or misuse their opioids and have higher depression and anxiety scores. The concern I have with this study, it was 2002 weed, not 2015 or 2018 or 2020 weed, which is much more potent, much more potent. We're in uncharted waters. The addiction rates, the old addiction rates were based on Degenhardt's study in 1995. It was I think it was 18% for the adolescent and 9% for the adult. But that was mid-90s weed, which is really weak compared to what you have now at your hands. The addiction rates out of NIDA are pushing 30%. That's what NIDA says marijuana has an addiction of. In states with medical marijuana programs have higher opioid overdose deaths than non-medical marijuana states. Portugal, which is kind of the gold standard of decriminalization and policy and all that other business, in 2018, they had the highest number of drug overdoses in 5 years prior. So commercialization may have a negative impact on the opioid epidemic, and there's some of the references there.